Hello, my name is Jay Gottlieb. I'm a dermatologist here at Miramar Dermatology, Skin and Cancer Associates. Let's talk about Dysplastic Nevi, also known as atypical nevi. Atypical nevi or dysplastic nevi are moles that have changed. Let me assure you that moles do not go from being normal to being cancer. Typically, moles that become cancer will go through several stages of change. At first, a mole is normal, and then it may change mildly. We call this mild atypia or mild dysplasia. That's where the name Dysplastic Nevi comes from. Once a mole turns mildly dysplastic, it can go on and become moderately dysplastic. If it keeps getting worse, it can become severely dysplastic and then turn into a skin cancer known as melanoma. Melanoma is the worst type of skin cancer that we can get. The reason that we consider this to be a dangerous skin cancer is because it can metastasize and travel from one area of the body to another. Most skin cancers that we encounter, other than melanomas, do not have the propensity to metastasize like a melanoma can. The actual size of the melanoma is not what causes the problem. It's the depth of invasion. So let's get back to dysplastic nevi or changing moles. It's important that once a year, after puberty, a patient has a full skin check by a board-certified dermatologist. We utilize an instrument called the dermatoscope in our office. When a mole appears anything other than normal, we will utilize the dermatoscope. This is a bipolarized refringent light that allows us to look below the skin surface at the actual pigment pattern and determine if, in fact, that mole looks as if it's changing. We always want to find these moles early in the changing process. The key to preventing melanoma is yearly skin exams. So, if you've been diagnosed with an atypical nevi or an atypical mole, it should be completely removed to make sure that there's no cells left behind that can cause a problem further down the road. I also need to mention that just because a mole becomes mildly dysplastic or moderately dysplastic, that does not guarantee that it's going to progress and become a melanoma. As dermatologists, we simply don't know which one is going to take that route. So, when we see an abnormal mole, we will biopsy that mole. When we biopsy a mole that looks dysplastic, we get back one of three diagnoses from our pathologist. They may tell us, even though the mole looked abnormal, it's perfectly normal. Nothing more needs to be done. The second thing we could be told is, the mole is abnormal, but it was completely removed at the time of biopsy. In that case, we like to recheck this site 3 to 6 months later just to make sure that we do not see any more pigment in that area. The third explanation that the pathologist can give us is that this was in fact a dysplastic mole and it extended to the margins of our biopsy. In that case, we need to go a little further and a little deeper and remove the entire mole. Nobody should ever die of skin cancer. Yearly exams are necessary to detect these changing moles that can turn into melanoma. I always explain to my patients there's 4 things that we need to do. For men, after the age of 35, they should have a prostate exam. When they get into their early to mid 40s, colonoscopies as directed by their doctor. They should also have a cardiac exam, cholesterol, triglycerides, and an EKG once a year. And the one that they forget about is the full body skin exam. Remember, we can only see 1/2 of our skin. Therefore, see a board certified dermatologist once a year and have your moles and your skin examined. Thank you very much for visiting us here at Miramar Dermatology Skin and Cancer Associates. If you would like to make an appointment, you can simply fill out the patient registration form by clicking on the patient registration form tab. You can also leave us a message that you would like an appointment by going to Contact Us, and we will call you and schedule an appointment. And if you're old-fashioned, you can simply dial our phone number 954-447-3200 and make an appointment. I hope this has been of some help to you. I look forward to meeting you.